Now in today's video, we're talking about 4 oxygen delivery systems, 4 of the most commonly used in a hospital setting, and sometimes people go home with this as well. So we're going to cover that absolute most popular home and acute care setting and look at 3 other alternatives. So let's go to the board. Now take a deep breath with me. That is glorious. Did you know that in that inhale, 21% of what you're taking in right now is pure oxygen? It's a gas that our bodies actually need in order to function properly. Now you may find that there are instances when it's harder to breathe, and this might be from an acute insult like an asthma attack or something more chronic like a chronic obstructive pulmonary disease, making it more challenging for your body to get the oxygen it needs to deliver to those cells. So sometimes we supplement with oxygen using a variety of devices. And in today's video, we're going to show you how with each liter per minute delivered of oxygen used across different mask styles, just what that changes in that percentage of oxygen that you're actually inhaling. Now, one of the most common types of devices used in a healthcare setting and at home is the nasal cannula. So those are the ones where the cannulas are very soft. They fit inside your nostrils. So here we have the nasal cannula. We're going to call this the low flow. There is a high flow nasal cannula that will be a different video. That one warms the air because it's coming at such a high concentration it can cause a real quick drying out of the nasal cavities and cause nosebleeds faster. So starting with the low flow nasal cannula, if we put it at 1 liter per minute, we're increasing that 21% natural oxygen that you're getting at room air. We're increasing it to a 24% oxygen delivery. If we go up to 2 liters, you can add an extra 4%. For each bump in liter with the nasal cannula, you can add 4% more oxygen delivery. So at 2 liters, we're at 28%. At 3 liters, we are at 32% oxygen. 4 liters is 36, 5 is at 40%, and 6 is at 44% concentration of oxygen with every inhale. Now, the volume of oxygen support that you need every minute will depend on your oxygen saturations. And I've got a video explaining that right here. You can take a look at that. Essentially, in normal, healthy lungs, we like your oxygen saturation to be above 92%. So when it dips down below that, we're recognizing that your lungs are struggling for whatever insult or illness it's currently working with. And we're going to support it while we recover you or we get you to a stable place, and you may find yourself on 2 or 3 liters of oxygen going forward to support the function of your cells. Now next we have is a simple mask. You can see I don't have anything down here for 1, 2, 3, 4, 5 liters of oxygen, and that's because we typically won't use a mask until we need more than 5 liters of oxygen. If you only need like 1 to 5 liters of support, you're most likely to be on the low flow cannula. Now there are times when we will use the face mask, and it depends on patient comfort and what their needs are. When we look at the simple mask though, you can see that it's the same. We're looking at 5 to 6 liters per minute now, and it will deliver 40%, which is the same as our nasal cannula, 40%. As we go up higher, 6 to 7, we're at 50%, 7 to 8, we're at 60% of oxygen delivery. Now this begins to change when we start to look at the partial rebreather. We actually see a dip in oxygen concentration at higher levels. So again, now a partial rebreather is typically not going to be used for 1 to 5 liters. Again, we're going to come back to that nasal cannula. But when we get up to delivering 6 liters, and we go to a partial rebreather, we see only 35% oxygen, which is the same as about 4 liters in a nasal prong. So we're seeing a bit of a dip in terms of oxygen concentration getting into the body with a partial rebreather. And again, you can see here at 8 liters, it's only at 50% oxygen concentration, where that would be the same as 6 to 7 on a simple mask. And the non-rebreather, we don't go up that high because it gets harder on your nose, causes more nosebleeds, dryness, irritation. With a partial rebreather, we can go higher, which is one of the advantages over the nasal prong, the low flow nasal prongs. The higher we go with the low flow nasal prongs, the more the irritation and the faster those nasal passages dry out and lead to complications like nosebleeds. So if we need to go higher, this is why we have these options. The partial rebreather, we have here at 6 liters, 35%. At 8 liters, it's 50%. And at 10 liters, we're getting 60% concentration of pure oxygen gas being delivered to your lungs in order to compensate for that deficiency that it's not able to function at its optimum on room air at 21%. Now, the fourth type of mask we're going to talk about is the non-rebreather. We have this here at the end because this one will deliver high levels of concentration of oxygen at lower rates per minute. So, starting at 6 liters per minute, we are at 60% oxygen delivery in every breath. Let's compare and contrast that. So 60%, 6 liters, non-rebreather. 35% with the partial rebreather. Okay, so this is almost half of what you can get with a non-rebreather. With the nasal cannula and the simple mask at 6 liters, we're in that 40 to 45%. We have almost 1.5 times that with the non-rebreather. And so how do you decide which delivery system you're going to use? Well, it depends on your patient's needs. One of the tools you're going to use to measure the effectiveness of this oxygen delivery is that oxygen saturation. Keeping in mind there is a dissociation curve, and we can talk about that in a future video. But essentially for today, what I want you to know is the oxygen that's being delivered through whichever of these 4 modalities you're working with is increasing the percentage of gas oxygen delivery to the lungs. We start at 21% and we are working our way up. So the more acute your patient, the more demand they have for oxygen, the closer you're going to find yourself onto this end of delivery systems. So today we covered 4 different ways that you can deliver supplemental oxygen to your clients. The nasal cannula, low flow, the most commonly used device in medical settings, the simple mask, the rebreather, the partial rebreather, and then the non-rebreather. Each one of them is utilized depending upon your patient's needs, so you're always doing your assessment. Your oxygen saturation is one critical point of information, but you'll also need to be talking and looking at your patient themselves. Now, depending on your patient's oxygen sat goals, you will titrate that oxygen level accordingly. As I said earlier, in a typical healthy lung set, we're looking at 92% and above is our target. But if you're working with someone who has a chronic lung disease like COPD, your targets might be lower. So you're looking at the patient, their response, their oxygen saturation, and you're going to titrate your oxygen accordingly within the parameters that you have been set out by your physician orders. Hey, thanks for watching. Now smash that subscribe button, become a fan of this channel, and share it with your friends, because you know everyone's got a question and I'm here to answer them. So if you have one that's not answered, drop it in the comments below and you might see your question featured in the next video. As for today, we covered 4 different methods of delivering supplemental oxygen to our patients. You may be finding that this is utilized. You may find yourself using this in a home setting, and I hope this has given you some information as to just how much extra oxygen you're getting in your boost. If you're working with clients in the hospital or acute care settings, now you understand the difference between those 4 styles, why we would choose them, and how much oxygen we're actually getting to them to support them. Thanks again for watching. Looking forward to seeing you in the next video.